Hello, everybody, and we are here as a national society, the STCCCV, at the ESC Madrid today, and I'm pleased to discuss with Professor Mirvat El-Asnag, TCT Middle East Director and SKY International Chair, PCI Board, and a very active interventional cardiology women. So we have the new guidelines about valvular heart disease, and I think about structural intervention that is very, very new from TAVI for young patients, mitral intervention. What about the hotlines and the news in these ESC guidelines?
Well, first of all, thank you for having me with you today. And the guidelines, as you mentioned, are very interesting because they did really address a lot of topics that we're currently seeing in practice. If we start with the mitral valve, they very elegantly defined atrial and ventricular mitral regurgitation. And for atrial, they were very clear that it's preserved LV function over ejection fraction over 50%, no regional wall motion abnormalities. The morphology and the motion of the mitral valve have to be normal, but a dilated annulus. And for that, they are affording surgical repair a 2A recommendation, and for mitral transcatheter edge-to-edge repair a 2B recommendation if they're ineligible for surgery. That's in terms of the mitral valve. Now, in terms of the aortic valve, the guidelines were very clear in broad terms to talk about expertise and volumes, and they recommend those with complex anatomies to be referred to high volume centers for procedures. They really emphasized the role of the heart team in the decision-making process. They emphasized the role of imaging, in particular CT and MRI, and really recommended that it become part of the evaluation algorithm for patients. What was interesting is they also gave a new classification recommendation, class 2A, for patients who are asymptomatic severe aortic stenosis, who have favorable anatomy to undergo replacement, provided that, they have severe AS, they have preserved LV function, and so on. And that they also have either symptoms down the line or they have progression of their gradient across the mitral aortic valve.
So, Mirvat, do you think that TAVI and mitral intervention on percutaneous way will be the future?
I think absolutely. As we gain more experience as operators in selecting the patients, in deploying the devices, and in anticipating complications and managing complications, that's on one side. And on the other side, the technologies are getting better. They're more refined. We're able to address different anatomies. For example, the guidelines also now recommend TAVI for aortic insufficiency if they're not suitable for surgical repair or replacement. So that's, again, something that in practice we see these patients that unfortunately are ineligible for surgery. So yes, I think the future is going to see more and more transcatheters.
And for women, any specificities in these guidelines, and also in our countries, Middle East and Africa? Is there any specificity?
I'm really glad you brought that up. And yes, the guidelines most certainly have a new section on special populations that do include sex, patients presenting with shock, patients presenting with multivalvular disease, and cardio-oncology. So I think the future is going to require us in the Middle East and elsewhere to really address these gaps that we currently have in evidence. So we do need more research to look at outcomes in women, complications in women. We do know most of the deterrence to transcatheter therapies in women is because of vascular and bleeding complications. And so as we get better with it, hopefully, again, we'll be able to offer it more, but we need the evidence.
So thank you, Mirvat. See you in Tunisia, and happy to be in the team of interventional cardiologists and women in cardiology. And I think you must stay tuned to see these new guidelines in our channel and our studio in September 12. It will be shared online also, and you are invited in Tunisia.
Always my pleasure to be with you. Thank you very much for having me.